Hi there and welcome to Colic Part 2. What do I do if I'm suspecting symptoms of colic in my horse? The colic is definitely a medical emergency and is very time critical. So knowing what to do when your horse presents with any signs is really important. The first thing to do, try to locate your horse somewhere that is safe, preferably with access to electricity and clean water and light in case you need your vet to visit. So once your horse is relocated to somewhere safe, of course, don't do this relocation if your horse is not comfortable moving. Wait until the vet arrives. But if you were able to do that, the next step is to take your horse's vital parameters. The information that we need at this point is your horse's temperature, heart rate, respiration rate, hydration status, and have a listen to any gut sounds. If you're unsure on how to do this, have a look at my video on the normal health parameters and understand how important it is that in an emergency you already know how to get these vital statistics. Once you have these health parameters, next step, which is step number 3, definitely call the vet. The reason I get the parameters first is simply because your vet will be able to help you more. I'm not putting off calling the vet. Simply giving the vet this information will help them make a decision about the next step. We want to get the vet on board. We're talking about a time-critical medical emergency, so call them as soon as you can. Step 4, observation. Not only continuing to observe your horse and behaviour, but have a look at the surrounding environment. Is there any fresh manure? Can you tell whether the horse has either had a drink or urinated? Is there anything unusual you can see that could give your vet signs of what's going on? Number 5, unless the vet that you are talking to directs you to do so, do not feed your horse and do not medicate your horse. And lastly, number 6, take your horse for a light walk. Now this is quite controversial. Do we let our horse roll? Do we let it lay down? Do we walk it around? The reality is the reason we stop the horse rolling is not because it's going to twist the stomach. However, it could really hurt itself. Remember, it's in pain, so it's not got great self-preservation going on. So we want to minimise any additional harm. Sometimes if you're early on, a light walk will actually help to move the digestive system and move any blockage out of the tract. But if the horse is uncomfortable and not tolerating it, just let the horse lie down and be comfortable and rest. Be aware too that many other horse problems can mimic colic, which is another reason to get the vet involved as soon as possible. Kidney issues, bladder issues, liver issues, and even respiratory infection issues can all mimic the signs of colic, so you need somebody to diagnose this for you. Okay, hopefully you've got the idea that getting your vital health parameters and getting the vet on board are the 2 most important things to be able to do for your horse. I hope you've enjoyed the video. Please like this video, subscribe to the channel, and you'll get notified of my next release, where I'll talk about what are some of the preventatives we can put into place so that we can reduce the risk of colic in our horses.